Hey there, it's Ryan Liberty, and in this video I'll be answering the question, what is obsessive-compulsive disorder, also known as OCD?
Ooh, ah.
Okay, here we are, and I'm going to answer the question, what is obsessive-compulsive disorder, also known as OCD? But before I get to that, I just have to make a little disclaimer here, which is that this is not the diagnostic criteria for OCD. It should not be used to diagnose somebody. In any way, a therapist or a licensed professional should be doing that for you. So don't use this to be diagnosing people around you or yourself. And this is just a description of what's going on. And if the label of OCD bothers you in any way, if it doesn't help you to heal, if it doesn't feel safe to use that label, you don't have to say OCD, you don't have to say obsessive-compulsive disorder. This is just a description to give you an idea of something that may be happening in your life or the life of somebody that you love. So that out of the way, I have notes that I'll be referencing. I always do because I want to get things right for you. But what is obsessive-compulsive disorder? What is OCD? So it features obsessions and it features compulsions. So what are those? Obsessions are urges, images, or thoughts that recur and they're persistent. They don't go away, or we have a hard time getting rid of them. They're just these constant images, thoughts, urges that keep surfacing over and over again. And they're experienced at least partially as unwanted or intrusive, and they usually cause some kind of stress or anxiety because the fact that they're surfacing. Compulsions are either mental acts, such as repeating words silently to yourself, counting, praying, or repetitive behaviors, such as making sure that things are in order, checking things, washing hands, for example, is the common one we always think of, but it doesn't have to be washing hands, it could be washing anything. So either one of those could be a compulsion, and what makes them a compulsion is that the person feels that they have to perform them either to neutralize an obsession, to suppress an obsession, or because they have some kind of a strict rule and they feel like they have to follow these rules. So these mental acts are meant to prevent the anxiety, either from an obsession or from a perceived dreaded situation that's going to happen, but they're not linked into reality. They're not actually preventing something. Like, for example, if you were studying for a test, that constant repetitive action of studying is designed to reduce your anxiety about the test. That would not be a compulsion because it's linked to reality. It makes sense that doing that is going to prepare you for the test. If you're washing the counter literally 100 times a day, then that's not actually going to help you prevent germs any more than the first 1 or 2 times that you washed it. So that's why you know it's a compulsion. Young children may not be able to say why it is that they're doing what they're doing. They may not outwardly be able to express that there's a compulsion going on or express why they're doing this. But that doesn't mean that it's not there. It doesn't mean that it's not a compulsion. So those are obsessions and compulsions. Part of OCD, there's more to it than just that. These things have to take more than an hour up of your day per day. And you can't be doing this because of a substance or a medical condition, and it's not something that's better explained by another disorder, including the other OCD, including the other obsessive compulsive and related disorders, as well as many other. I couldn't list them here because obsessive compulsive disorder can show up in so many different disorders. So just be aware that you may find it in a lot of different instances, but it can't be those other disorders if it's obsessive-compulsive disorder. However, the caveat to that is that obsessive-compulsive disorder it's comorbid with a lot of disorders, so it appears alongside these other disorders. And something that I noted was that 76% of people with OCD also have an anxiety disorder, and 63% of people with OCD also have a depressive or bipolar disorder. So it's really just something that can be experienced in a wide variety of contexts. And common themes around obsessive-compulsive disorder, and by no means is this an exhaustive list, but these are just common things that show up. You have cleaning, symmetry, forbidden thoughts, and harm, like taboo thoughts and self-harm, harming others, those kinds of things. So we have a number of specifiers to clarify what's going on when we have obsessive-compulsive disorder. So those specifiers are with good or fair insight. And with good or fair insight means that you recognize that those beliefs are probably or definitely not true. There's also with poor insight, which means that you think that the beliefs are most likely true. And there's also with absent insight or delusional beliefs, meaning that you completely accept that those beliefs are true. Poorer insight is linked to a poorer long-term outlook, unfortunately. And there's also a specifier of tic-related, and if you currently or in the past have had a tic disorder, then you would get this tic-related specifier, and that is 30% of people with OCD actually have had a lifetime tic disorder. Treatment, there is treatment for OCD. Usually you would go for some form of cognitive behavioral therapy, which is CBT, and it's called exposure and response prevention, so ERP. There's also a treatment that's available called ACT, which is acceptance and commitment therapy. And of course, there's medication if that aids in the healing of and the therapy that you're going through. So speak with the therapist, speak with somebody, and they'll be able to put a program together for you to help you manage all of this. And so what does it feel like to have OCD? How does that feel? So typically, they're going to feel, if you have this, you're going to feel anxiety symptoms in your body. So you may have chest pain, you may have racing heart, racing breath and shortness of breath, pains, tingling maybe in your feet and hands, those kinds of things. You may experience panic attacks if it's something that's really intense for you, recurring panic attacks. In your brain, cognitively, what you're thinking, you're going to have those involuntary unwanted thoughts and the obsessions. You're going to believe that those thoughts are very often equivalent to actions. So you may, an example of what I'm talking about when I say that is that you may, if you're thinking about punching somebody, you may feel that that's the same as actually punching somebody. So you feel the intensity of doing like punching somebody. You would feel the intensity of punching somebody just by having the thought of I'm going to punch somebody, and that can be very stressful. That can be very confusing. You also have this kind of, I think of it as like a somersault of thoughts, where sometimes you have one thought, an unwanted, intrusive thought, and then you use another thought to kind of neutralize it and combat it. So it leads to this chain of thoughts sometimes that just keeps going on. And that would be something that we would call pure OCD, where it's just the obsessions just keep going on and on and on. And there's maybe not an obvious compulsion because the compulsion is the obsession. And that's why I think of it as like a somersault. You also have emotionally what's going on for you. So you may feel like you're responsible for things that you're actually not really responsible for, because of the way, how intense all these thoughts and these things that are going on feel. And you may feel threatened by things that may not actually be threatening, because again, everything just feels intense when you have obsessive-compulsive disorder. When you're faced with uncertainty, when you have to make a decision, that could be very stressful for you. You may feel like you're incomplete when you haven't finished the rituals or the compulsions, and you may feel disgust or shame about the whole thing, unfortunately. So behaviorally, what may happen is you may avoid things that trigger these obsessions and compulsions. So you may stay out of like a social situation, for example. You may continue doing these compulsions until it feels right, until you feel like it clicked, you got it. The repetitive behavior, you may do that, and instead, how do I say this? So when you do these repetitive behaviors, it's not necessarily going to bring you pleasure. I think to people from the outside, they may see you doing this and think you enjoy it, but it's not about that. You'll see somebody doing the behavior, it's not about enjoying it, it's about getting relief from the obsession. So that's a little distinction to make there that you'll see in their behavior. They may hoard things. You may become late to appointments as a result of doing the obsessions and the compulsions. You may have difficulty in work or at school. You may avoid the social situations, as I mentioned. You may have trouble in situations where you have to be independent and make those decisions. And you may try to get other people to comply with your rules to kind of also manage down your stress and anxiety over all of this. So I hope that's given a nice, well-rounded picture of what OCD, Obsessive-Compulsive Disorder, is. If you have any questions or any comments that you want to leave about it, maybe give me a little insight into your experience, I'd love to hear it, so leave that below. But I thank you for taking the time to spend and learn about it with me today. Thank you. Hey, it's Ryan Liberty. If you like that video, please give it a thumbs up, share with a friend, and leave any questions or comments down below because that would really help me out. If you're somebody who's gone through a traumatic event and you're feeling cut off from the people around you, I have a free course that will help with that, so please click to get it. And if you'd like to see the rest of my videos, please click subscribe. As always, I want to remind you that your life matters. Nobody can question your worth. However it is that you're feeling, whatever it is that you're going through, it's okay and you are loved. Thanks again for watching.